Hello, Mr. My name is KLEBER and my topic is Vedolizumab versus Adalimumab for moderate to severe ulcerative colitis. Definition: Ulcerative colitis is a chronic inflammatory disorder of the large bowel characterized by abdominal pain, bloody diarrhea, and fecal urgency. 1. Agents that are commonly used when conventional treatments, aminosylates, oral immunomodulators, and corticosteroids, 5 included tofacitinib, a small molecular Janus kinase inhibitor, and biologic agents such as tumor necrosis factor inhibitor, Adalimumab and Golimumab, and Vedolizumab, an anti-integrin antibody. They watch the video.
I'm Bruce Sands. I'm from Mount Sinai in New York, and here at DDW I presented the results of the Varsity study. The Varsity study was the first head-to-head trial of two biologic therapies for the treatment of IBD. Namely, we were comparing Adalimumab, an anti-TNF antibody, to Vedolizumab, which is an anti-alpha-4 beta-7 integrin antibody in patients with ulcerative colitis. These are two widely used treatments for ulcerative colitis, but the two have never been compared head-to-head in a randomized controlled fashion, and this is what we did in a double-dummy blinded study. So the study was run over 52 weeks, and the primary endpoint was clinical remission at week 52, and those results were presented a little bit earlier this year at ECHO and showed that Vedolizumab was superior in achieving clinical remission at week 52. Here at DDW, we presented additional results looking at outcomes such as histology at week 52 and showing that the histologic outcomes were also superior for Vedolizumab over Adalimumab. And additionally, we looked at the earlier outcome results, namely at week 14, we looked at clinical remission and endoscopic improvement and other outcomes and found that by week 14, Vedolizumab was already superior to Adalimumab, and that those treatment differences emerged sometime between week 6 and week 14. So overall, we think this is an important study. It helps us understand where to position these drugs in relation to each other. I would note that most of the effect was in patients who were naive to anti-TNFs and to biologics. There were only 20% of patients who had prior treatment with infliximab. Those patients did equivalently well whether they were assigned to Vedolizumab or Adalimumab. So we think this is an important, very significant study, should change practice over time. Thanks for listening.
Next, pros and cons. Screening segments include a physical examination, endoscopy, findings with red and rectal localization, the total Mayo score, blood and stool tests, tuberculosis screening. The score on the inflammatory bowel disease questionnaire ABDQ score ranks from 32 to which higher scores indicating a better quality of life. A night and questionnaire to identify possible symptoms of progressive multifocal leukoencephalopathy. They watch the video.
Hi, my name is Ed Loftus. I'm a gastroenterologist at Mayo Clinic in Rochester, Minnesota, and I wanted to talk to you today about an article that was recently published in the British journal called Lancet, which is a very high-impact medical journal. And the paper Vedolizumab, also known as Rumab beta 7. And so this molecule is an antibody directed against a substance called beta 7 integrin. Integrins are molecules that interact with adhesion molecules, and they allow white cells that are in the blood vessels. Think of the blood vessel as a tube. The white cells are in the tube, and they need to leave the tube, the blood vessel, to go into the soft tissue and cause inflammation. So these integrins are on the white cells, and they interact with these adhesion molecules, which are found lining the blood vessel cells. And so that interaction is sort of like a zip code for the white blood cell to leave the blood vessel, go into the soft tissue, and cause inflammation. So this beta 7 integrin is actually found on two different integrin molecules. One is called alpha 4 beta 7 integrin, the other one is called alpha E beta 7 integrin. And these interact with two different adhesion molecules. One is called MADCAM, and the other one is called E-cadherin. And MADCAM is found only in the gut, and E-cadherin probably regulates the ability of the white cells to leave the epithelial lining or the mucosal lining. So in any case, this drug was studied in a group of patients with moderate to severe ulcerative colitis. There were about 120 patients in the trial. It was randomized, placebo-controlled, double-blind study, and there were 3 treatment arms. And so in the first arm, patients only received 4 infusions of placebo. In the second arm, patients received 300 milligrams of etrolizumab at weeks 0, 4, and 8, and they also received a placebo infusion at week 2. And in the third arm, patients received a loading dose of 420 milligrams of etrolizumab at week 0, and then at weeks 2, 4, and 8, they received 300 milligrams. And the primary endpoint of the study was remission of ulcerative colitis at week 10. So again, they got these infusions at weeks 0, 2, 4, and 8. Primary endpoint was remission at week 10. Remission is defined in most of these studies as a Mayo score of 2 or less. And the Mayo score is a combination of score based on number of bowel movements per day, how much rectal bleeding you're having, what your colitis looks like at the time of endoscopy. Is it in total remission, or is it mild, moderate, or severe? And then the physician's global assessment of whether you're mild, moderate, or severe. And those add up to a total of 12, and anything 2 or less is considered remission. So at the end of the study, at week 10, none of the placebo-treated patients were in remission. 21% of the patients on the lower dose of etrolizumab were in remission, and 10% of the patients at the higher dose were in remission. And those differences in the 2 etrolizumab arms were significantly higher than that in the placebo arm. So the trial met the primary endpoint. Also, they looked at serious adverse events, and the rate of serious adverse events was 12% in the placebo-treated patients. In one of the etrolizumab arms, it was 12%, and in the higher dose etrolizumab arm, it was even lower than 12%. So the rate of serious adverse events was no higher in patients receiving drug compared to patients receiving placebo. So this phase 2 trial was a positive trial, and this drug is going on to be studied in phase 3 trials for ulcerative colitis. So again, another drug in this class of lymphocyte trafficking blockers, and we're looking forward to its development. Thanks.
Application in nursing. In this trial involving patients with moderate to severe active ulcerative colitis, Vedolizumab was superior to Adalimumab with respect to achievement of clinical remission and endoscopic improvement, but not corticosteroid preclinical remission. Next video.
a new formulation of Entyvio was developed so that patients would have the option to take Entyvio long-term as subcutaneous treatment and self-administration, or continue with the already established intravenous formulation that requires dosing in an infusion unit or hospital or treatment unit, or in an office infusion unit, something like that. So the development of this new subcutaneous formulation really gives patients great options with long-term treatment with Entyvio to self-administer and dose at home. So this is really a post hoc analysis of long-term extension data, and so this is often done. And so every year or so, over 5 years, there will be an examination of the data. There will be data cuts, but the study is intended to go out 5 years. But FDA, the filing, the biological license application to the FDA has already been submitted, and things are in the works for approval of sub-Q Entyvio, and that approval is anticipated in 2020. It may be early in 2020, it may be in the middle of 2020. It's not absolutely unknown, but it could be early, and then there are going to be different transitions that patients have the option to proceed with, going from their current IV formulation to sub-Q, or new starts, who go on IV Entyvio. They may plan to transition or anticipate to transition as early as week 6. I think the data that we have so far indicates that we can transition in several different ways, and in practice it's going to be transitioning likely in even more ways, and it looks like all of them work. The pharmacokinetics of this new formulation is favorable, and when I say favorable, the blood levels are higher than what is than the blood levels for the approved every 8-week IV formulation. So it looks good. It looks like something that works as a practical transition pharmacokinetically as well as convenience-wise for many, many patients. Certainly for the majority of patients who are taking Entyvio, it looks like a slam dunk, and it may work for all, but it certainly looks very practical for the majority of patients. And then it's just that sort of shared decision making with patients. Do you want to have IV infusions long term, or do you want subcutaneous infusions, and whatever works out best for that individual.
Next, the issue in Ecuador. Summary: in Ecuador, there are no epidemiological data on inflammatory bowel disease. We seek to determine the epidemiology and behavior of ABD in the Ecuadorian population. Method: descriptive observational study, using the clinical record of patient diagnosing with ABD from the 3 referral centers for ABD of Ecuador Social Insurance from next video.
Hi, I'm Ed Loftus. I'm a gastroenterologist at Mayo Clinic in Rochester, Minnesota. I work in the inflammatory bowel disease clinic, and so I'm a gastroenterologist who specializes in taking care of patients with Crohn's disease and ulcerative colitis. And I wanted to talk to you today about a recent article that was published about a drug called Vedolizumab. So Vedolizumab is biologic. It's a monoclonal antibody against a molecule called alpha-4 beta-7 integrin. And this molecule interacts with a particular type of cell adhesion molecule. So that integrins sits on the white blood cell. The adhesion molecule sits on the endothelial cell, which is a type of cell that lines the blood vessels. And the interesting thing about the particular cell adhesion molecule that it interacts with is that it's only found in the gut, or it's basically found in the gut. It's found to a much lesser degree in a few other areas of the body. So this is a biologic that interferes with the ability of the white blood cell to leave the blood vessel and go into the tissue and cause inflammation. And because the target molecule, that interaction is gut specific, it's a relatively gut specific or gut selective biologic agent. And so this drug was approved by the FDA about 2 years ago for both Crohn's disease and ulcerative colitis. And recently in the journal called Gut, which is always a great name for a journal, there was a safety study published about this molecule. And so they took the results of 6 different clinical trials, 2 phase 2 studies and 4 phase 3 studies, and this involved over 2,800 patients that were followed for a total of over 4,000 person years, and they just analyzed the safety of this medication and compared it to the patients who were treated with placebo. And what they found is that essentially there was no serious or significant safety signal with this medication. In other words, the rate of adverse events and the rate of serious adverse events was similar compared to the patients treated with the actual drug and the patients treated with placebo. There was no significant differences in those groups. In fact, in the ulcerative colitis trials, there were fewer serious adverse events in the patients treated with the drug compared to placebo.
Next, in conclusion, colitis is inflammation of the lining tissues of the large intestine colon. People suffering from colitis might have typical symptoms and symptoms that include abdominal pain, cramping, bloating, and diarrhea. Some types of colitis may be associated with bloody diarrhea. Colitis can be part of disease that affects other parts of the body, causing fever, chills, fatigue, malaise, and dehydration symptoms, weakness, decreased urinary output. Ulcerative colitis is a chronic condition that has other manifestations in the body, including mouth ulcers, holes, swelling, and skin inflammation. That was the video.
Hi, my name's Ed Loftus. I'm a gastroenterologist at Mayo Clinic in Rochester. I specialize in the care of patients with Crohn's disease and ulcerative colitis. And I wanted to talk to you today about a new drug that was recently approved by the US FDA and also approved in Europe for both Crohn's disease and ulcerative colitis. And the drug's name is Vedolizumab. It's a little hard to pronounce. The trade name of the drug is called Entyvio. And this drug represents a relatively new class of medications for IBD. It's a biologic drug. It's an antibody against a molecule called alpha 4 beta 7 integrin. And what that molecule is it's on the white blood cells. And that molecule interacts with a molecule on the blood vessels that serves as sort of a zip code for where the white cells are supposed to go. And it turns out that the zip code molecule is only found in the gut. So this is sort of a targeted biologic for blood vessels in the gut to block the white cells from leaving the blood vessels, and therefore they cause less inflammation. And so this has been studied in large numbers of patients with both Crohn's disease and ulcerative colitis. In the phase 3 studies of this drug, most of the primary endpoints were met, and this includes things like remission, response, steroid-free remission, and this drug theoretically may have a more favorable safety profile than some of the anti-TNF molecules, although it's always too early when a drug first comes out to really talk about safety. There were some theoretical concerns that a parent molecule could cause a neurologic condition called progressive multifocal leukoencephalopathy, but that can't happen with this molecule because this, again, the target molecule for this drug is not expressed in the brain, it's only expressed in the gut. So this rare side effect that occurred with the parent molecule does not occur with this molecule. In any case, this drug is now hitting the shelves of the pharmacy, so to speak. It's given as an IV infusion, sort of like infliximab. So you have to go into a doctor's office or an infusion center or a hospital to get the drug. It takes about 30 to 60 minutes to infuse. The first 3 doses are kind of close together, 0, 2, and 6 weeks, and then it's given every 8 weeks after that. And we're looking forward to this drug coming out. People have to fill out some paperwork to make sure their insurance approves the drug, but it's just another nice option to have because many of our patients have already failed multiple therapies, and it's good to have a new drug in a new class available. Thanks.
Next. Thank you, teacher.